Hello, this is Dr. Nancy Trimbley with your Healthcare Arsenal podcast. This podcast is designed for that person who knows there's a better way towards health and wellness. They just don't know what that better way is. And my goal for you is that with each passing episode, you get closer to being your own best expert. So today we have back with us Dr. Ashley Weiner and Dr. Alli from Pelvic Affinity in Crown Point, Indiana. And we had such a blast when we talked last time. We knew we had to schedule another meetup. So today is your lucky day. Hello, you guys.
Hi. Thank you so much for having us back.
Yes, thank you so much.
The first time was just too much fun.
It was so much fun. It was so much fun. Yes, the fun in the pelvic cavity is unending.
Yeah, for sure. Very true.
So today, now last time we talked all about your practice, Pelvic Affinity, and we talked about the problems that can arise and why they arise with either sexual function and intercourse, problems with urination, with elimination, also pain and pelvic region, the genitals, and why that occurs, and what you guys do to help people get rid of their problems. Now, we did, the three of us speak at some point about your life within a hospital system. And then there was an ugly exit, which was very unfair on many levels to the two of you and also to your patients that you were treating. And now you chose when you opened your own business to be outside of the insurance-based the whole paradigm. So you only take self-pay. Which in my practice, we have a certain portion of a lot of self-pay, probably almost 50% of our practice is self-pay. We don't like Trimbley Chiropractic does not like dealing with insurance at some points. We've had some really painful times based on non-payment, on audits, on have to send in refunds, how people don't understand what's covered and what's not. Things will suddenly be not covered that they were told would be covered. And we're just in the middle. We're just trying to put one foot in each world, one in the patient's world, one in our billing world. And so let's talk about your view of this whole insurance thing. Like tell our audience about that from the perspective of you as providers.
I think when we do insurance, it takes away from treating the actual patient. I felt like when I worked at the hospital-based setting, there was a new requirement out of us that we had to do on a monthly basis. So whether it's this form, that form, pre-authorization, I mean, just the steps to even see a patient, your 45 minutes is now cut into 20 minutes because we're spending all this time with paperwork. And then it's getting away from actually diving into the patient's complaints and concerns because they have to fill out this and that, and I have to be required to ask these certain questions that literally don't even pertain to what we're doing. And it almost was just getting exhausting. Yeah. I was getting irritable with the constant change of requirement from us. I felt like we were required to do so many things instead of being a clinician.
Right. And it's like we were never taught to do that type of thing in physical therapy school. When you go to physical therapy school, you are learning assessment, reassessment, taking a great subjective, getting these measurements, helping these people, and then you get out in the real world and 90% of your job is dealing with finances and insurance and filling out forms and, oh, this person needs this date done by this. And it's like, we felt like the quality was slipping because of that, and we weren't able to focus and hone in on our skills because we were spending so much time typing.
Yes.
Or even like the peer-to-peer reviews. How many times have our services been declined. So now we have to do a peer-to-peer review. And I would literally spend 20 to 30 minutes on the phone with an insurance person to try to convince them that they still need therapy. And the entire time I always got denied.
And mind you, the person on
Always.
the other end is mostly not even a medical provider. It's
Right.
like just a person that's trained from an insurance company. So it's like, why am I explaining my findings to someone that doesn't even understand my findings?
It was time-sucking nonsense.
Mhm.
TSN. TSN.
Time-sucking nonsense. TSN, absolutely. And I know other physical therapists I've talked to on the podcast have said, you know, the person comes in with this problem, they have this history, they've already had all these other interventions, and the insurance company approves 4 visits.
Mhm.
What?
I
I'm
know.
supposed to fix this person in 4 visits?
I have one particular person that always sticks out in my mind. She was the sweetest, and I was seeing her for a while, and she had MS, and they were giving her 2 visits at a time. 2 visits. It's like, this is a chronic condition. She's going to need more than 2 visits. I just could not understand. No matter how I put my paper, no matter how I type my notes, it was always 2 visit, 2 visit. And then you're doing a note after every visit.
And then remember when they said, oh, you have to type it this way, you got to use this word, you got to use this phrase. Come on. Can I just like not do all of that and just focus on the patient? But no, it's the half of the piece is focusing on how good your notes are so things are covered.
Yes. Yes, I write about that in my book, Stealth Health, where the documentation becomes more important than the individual.
Oh, yes.
It's not fair.
No, it's so and patients do not understand that. They don't understand when they walk through the doors of a hospital system, it is part of the system that wants to keep them sick.
Yes.
That wants them to continue to go back and be on more drugs and have more intervention and be more ill and be more, in my mind, more subdued, like they are more malleable to be just a person that it just will just stay at home and be miserable and not experience joy and just like under the thumb of the system.
Definitely a revolving door. And I feel like it's really hard to even grow as a provider when we're just going through the emotions of survival.
Clocking in,
clocking out. I mean, your productivity, it's like they look at all of that because reimbursement's so low, so they're doubling up on people per provider just to keep the lights on. I don't know, it's just too much. You can't grow as a provider in that way.
No, you can't. And you can't experiment. Maybe experiment's the wrong word, but like at Tremblay Chiropractic, we use so many things that are outside of the conventional, even chiropractic, cold laser therapy and functional frequency medicine and decompression. And we tell people when they call in as a new patient, be aware. Dr. Nancy will most likely recommend something to you that is not covered by your insurance. It's not covered by any insurance. Are you willing to hear what she has to say, or at least be open to that possibility? And if they say, oh no, absolutely not, I just want to do what my insurance provides, we tell them you might want to go somewhere else because I can't do my best work.
No, that's just not the right person, to be honest. I mean,
that's okay. And that's okay. You know, some people want to just stay in the system, which is fine. If they want to use their insurance benefits, that there's not a problem with that, but we'll tell them on the phone that maybe this isn't a good fit, but we have recommendations for where you can go if that's the route you want to take. It's just not taking it personal and just moving forward, but it does help you kind of niche down into people that are really committed to their health and feeling better and getting down to the root instead of just Band-Aid.
Yes, totally. Yeah, and for even after all these years, I am still like, when people say, "Nah, I don't want to do that. I'm just gonna go get surgery." I'm like,
I know.
You know what? Call me if you have trouble afterward. You might.
I-
You might still have trouble, and I could still work with you.
Correct. I feel like as long as we provide, as long as they're aware of their options and they made the choice, it's their choice.
Mhm.
I know that we are the best in the area. I'm confident in our skills. I'm confident in all of the training that we've gotten. I mean, same for you. You know what you're doing. You know what's right. You know how to treat people. And if they still want to use their insurance, the downfall perhaps is just the quality of care, and that's okay. And you know, it is what it is.
Mhm.
It is what it is, and I tell them, the door's always open.
Yes.
Yep.
Exactly.
You know what? Anytime you want to come back, we're here.
Yep.
And like you say, I have confidence in my skills, and that I have such a huge like positive track record that it's okay. It's
Yeah.
okay.
Yep.
You know my job is to tell you what you need,
Mhm.
and then your job is to tell me what you want to do,
Right.
and
Exactly.
then
And
we
I'm
go from
sure,
there.
I'm sure you've come across this too, where you've gone a couple months, someone calls, they'll go somewhere else, and then a few months later, it's the same person calling back. Hey, remember me? I changed my mind. I tried somewhere
Right.
else, and that's fine too. It's just they got to go on their own journey, and
Yes.
they'll find their way back if it's the right fit.
And if patients don't feel comfortable with the internal piece and they want something conservative, like, I want to try this without internal, then not our person anyways, because it's like I don't feel comfortable prescribing exercise when I don't know what's going on. You know, if I
Yes.
don't even touch a knee, I'm not going to say you have a torn meniscus.
Mhm.
Yes.
So if patients are, oh, I don't want any internal, I want to use my insurance, it's kind of like, okay, that's perfectly fine. They have to match our ethos. It has to be a good candidate for both parties.
Otherwise, everybody's frustrated.
Exactly.
Yes.
Mhm.
Yes. Yeah.
Yeah. And I know we have some people that kind of slip in that only want to do what their insurance covers, and they do okay, and sometimes they do great. I mean,
Yeah.
sometimes, I get surprised every day. But yeah, for the majority of people at some point down the line, I'm like, I know we talked about this before, but it would probably really help if.
Mhm.
Right.
Mhm.
Right.
Oh, we've had that conversation many times.
Yes.
Right.
Yes.
Right.
Yes.
So I have a
But
theory on like why the insurance industry, like in my world, why the insurance industry would rather pay tens of thousands for a
Mhm.
surgery rather than a couple thousand
Mhm.
maybe for continued chiropractic care.
you know
Like,
what's interesting? The eval price at the hospital is like $600 to $700 for
just for the
45
evaluation.
minutes. For
For no
45
treatment.
minutes. No. The treatment is around $400.
Mhm.
So insurance is willing to cover that
Therapy.
but they can get like a whole plan of care with us for 60 minutes one-on-one for like $1,000.
Yeah.
But yet you can get like only 2 to 3 sessions through the hospital and be over $1,000.
Oh my gosh.
So if you haven't met your deductible,
Right.
and people's deductibles are high, $5,000,
Mhm.
$2,500, you can get a literally whole plan of care below that, and then spend that when you get an MRI. Spend that when you're getting something more like invasive.
Mhm.
Like you can use that for a more invasive thing. It's like, really? It's just crazy because people have spent more money coming to us at the hospital,
Mhm.
in the hospital setting, than they have here.
Wow. Yeah. Yes. It's baffling on multiple levels. Like that's one of the things. And you touched on something. Uh, let's see. Oh yeah, the evaluations they pay more than the treatment,
Mhm.
and so my theory on why they would rather spend all this money on these greater interventions that create potentially more side effects and more problems,
Mhm.
thinking of spinal surgery in my realm, Okay, so yeah, this is what you touched on. The more the more diagnoses you have. So you come to me and I bill insurance, and I have to bill the insurance that you have degenerative disc disease, which is totally treatable. You
Mm-hmm.
don't need surgery, but
Correct.
now you're labeled with that.
Mm-hmm.
Mm-hmm.
And then they go to their family doctor, and their family does, oh, your A1C is a little high, and so I'm going to prescribe a drug for that. Now it's not that much, it's a very low dose, don't worry, but now you're labeled with that diabetes diagnosis. So the next time you go to purchase your insurance policy, guess what? Your premiums go up and up
You
and
know
up.
what? I never thought about this, but you were so right.
And then couple that with these high deductibles that everybody has to meet every single year. So now you're
Mm-hmm.
paying out this premium. You're out of pocket paying out of pocket with your deductible anyway for a lot of the year.
Yep.
And then the year expires, and once you know it, oh, there's your deductible again.
Yep.
I
It's
think
a
that's what it
business,
It
is.
is a business.
and
They want you to be sick.
and they want you to be in the business. They're not looking out for you as the person. They're looking out for their business. What's their bottom line? What can they get out of you? It's a business, and it's a
Mm-hmm.
cutthroat one. It's not a nice business. Let's just say
No.
that.
It's not. And think about years ago, I haven't looked up this stat lately, but the billionaires in the United States, like 3 or 4 of the top 10 billionaires in the United States are CEOs of insurance companies.
Oh
Mm-hmm.
yeah.
Mm-hmm.
What
Oh
is up
yeah.
with that?
And then, you're getting a bill like at the hospital system, you're getting a bill like 8-10 weeks down the line.
Yep.
So if you haven't even met your deductible and you don't
Mhm.
even realize that, you're not even getting a bill until
You're
down the
done.
line, until you're down 10 weeks down, and they're like, oh, what the heck is this? I've been paying this much for therapy or whatever it may be. I don't like the sneakiness
Sneaky.
Right.
about money. I want to be able to budget for my expenses, know what I'm paying, be
Mhm.
transparent, things like that.
Exactly.
Yeah, and it's and that's the beauty of when somebody pays out of pocket from their own wallet, is that I know you guys do this and we do this, like, okay, this is what you need and this is how much it's going to cost.
Yes,
Mhm.
We're,
nothing hidden, no hidden fees, none
Mm-mm.
of that. It's like, this is what it's going to cost. This is how many visits you need. You can get a package, you can pay a la carte. It's up to you. But the beauty of it all, we can do whatever we want with our sessions.
Right.
Birth prep.
Mm-hmm. Right. That's not a diagnosis. There's technically nothing wrong per se, but we have a lot of people that are very proactive in their health, and it's like, well, I don't want anything to go wrong, so I'm going to do X, Y, and Z, which is, I don't think the insurance would even look at that, because they're like, well, what's wrong with the person?
Like pushing mechanics,
Yeah.
how to breathe during labor, a pelvic positioning during labor, how to get the baby down, things like that. That would not be insurance. Is
Covered.
like, no, I'm not covering that.
Yeah.
And so you're playing an insurance game and you can't see these people.
You have to give them a fake diagnosis.
Yes.
Which is stupid.
Which
Stupid.
is stupid.
But then say that somebody wants to be proactive. They come to us at 20 weeks. Nothing's necessarily wrong. We do an evaluation. We can see them once a month, 20 weeks,
Mhm.
24 weeks, another time at, 30 weeks. And then once they're reaching the end, we can see them a little bit more consistently. So with insurance, they tell us when to start, when to end, how many sessions.
And that would be a new eval every time.
It
And
would.
it's like, Bill, new eval.
Bill, new eval.
So it's sneaky. It's very, very sneaky. And another thing, and maybe Dr. Nancy, you can kind of tell me if chiropractic is the same, but for PT, like if you work in an outpatient physician-owned clinic versus a hospital-based clinic versus an outpatient PT-owned clinic, all of those reimbursement rates are different.
Uh-huh.
The hospital is always the highest, always, pretty much across the board.
Because they can negotiate.
They negotiate, and they have the best legal teams, and they have the backing behind that. So the hospital is raking it in, even though you could get, it doesn't necessarily mean the quality is the best. It just
No.
means that they have a contract with blah, blah, blah.
And then
to bill that much.
And then insurance is telling me how much my salary is.
Right, pretty much.
Yeah, you're right. I never thought about that.
So insurance is telling me what my hourly wage is.
You're right. And
Because
it's so
if you
random.
get contracted with them and they agree with a number, you didn't pick that number. They picked it for you pretty much. So then they're picking your salary, even though you went to school. We have our doctorate degrees. How many hundreds of thousands of dollars have you spent on education? I mean, a shit ton. And yet an insurance company is going to tell me how much I make.
I'm worth, right. And chances are, over time.
No.
And you know how it goes. Every year the reimbursement kind of like dips down just a little bit. Couple dollars. Yeah.
And it's constantly changing. So it's a headache. Oh, now you need this tool. Now you need this objective. Oh, now you need to mark this and mark that. No.
I know.
That's what the frustration was. I would say the last year of working at a hospital-based system was, I felt like every few months I walked in, hey, Ash, you're going to have to do this for now on. Oh, we need to peer review other notes, people's notes. What? It's so much stupid stuff that it takes you away from evolutionizing your practice.
Yes.
Because I have to read Susie's notes and make sure that they're Medicare friendly.
It's really silly too, because a lot of this stuff is literally just a smart phrase that you just click on. So it's not like you're really like, oh, I got to think this out here. Like you're typing a quality note. No, you're going click, 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 like smart box text coming
up. And then forming a new smart box text. And remembering to click that for this insurance and that for that insurance.
That's the funniest thing when we're training a new staff person. It's like, oh no, you can't bill that because this is such and such insurance. You have to, that's going to be self-pay. Oh, but this one, you can bill those together. But the wording here, we got to change that wording. Use your macro. It's like so.
And then we had to make stupid goals. And I remember one of my patients read the note of the goals.
Oh my, I remember this.
Don't
she's
you
like,
remember that?
I can walk.
I know, but I may. She's like, you're saying that I can't walk or something like that. And I'm like, dude, I need something for these insurance companies to pick it off. I mean,
it was a gait distance.
It was a gait distance.
And she's like,
goal.
I can walk. I walk all the time.
I know.
She's like,
I know. It's just a headache. I would rather focus my time on continuing ed and doing that than focus on the whole insurance piece. And I love that we can do whatever we want with our sessions, start them whenever we want. We just booked someone who was 9 weeks pregnant and we're not seeing her till 20 weeks pregnant, and we were able to even do that and not have a specific start date and not have a specific end date. It's like, the whole freedom of it is just different.
It's great.
Yes, I totally agree. Now, so one of the things we touched on a few minutes ago with paying your premium and you have this large deductible, I have this idea for a better route towards healthcare. And, the quote Affordable Care Act, which was enacted in 2008, which was totally made healthcare unaffordable, or medical care, not healthcare, but medical insurance. And there's the health savings accounts, which sometimes if you have a large employer, they might donate towards your health savings account, or you as an individual can invest in that. What if an insurance company, or maybe we wouldn't call an insurance company, but said, okay, you have this much in your health savings account. Maybe if you buy this policy, we'll match that account, and you can use whatever you want. You can go to pelvic affinity, you can go for acupuncture, you can go for chiropractic, you can go for medical care, you can get blood tests, you can go for MRI. Use it however you like, but it is because you've donated or you've invested yourself, plus you've also got this policy. And you know what? You might not use all that money every year. So then therefore you haven't used the policy and they're not
Yeah.
losing anything. And then that person has complete choice.
Yes.
I'm such a fan of our own freedom of health choices and not being
Absolutely.
funneled into what conventional medicine has to offer, because that's mostly what insurance is
Yeah.
Oh
covering.
yeah.
Well, that would make too much sense, Nancy.
I
It
know.
would make way
That
too
would
much
mean that
sense.
that would mean that everyone would get better.
Yeah.
Yes,
And,
yes.
and
Why
we
would
can't
you want
have that.
How dare you?
We
How
need
dare
people
you
to
want to
be.
get people better? But no, I that makes perfect sense, and we should have that.
Mm-hmm.
Absolutely.
I always, now that I've kind of like retrained my brain, because I will say that I was an insurance-based therapist for a huge chunk of the first part of my
Professional.
profession.
Mhm.
So
Same.
it was a relearning. But now I look at even my own insurance and say, we probably aren't going to need this heavy of this type of policy. Let's
Right.
throw that into a savings account. So just in case we need something like that we want to pay for, like that's our own little health savings account
Yes,
per
exactly.
se. So a lot of our patients do that actually.
Yes. A lot of our patients use their HSA, FSA, any medical cards they may have,
Or even just their own savings account that they have designated for health,
Yep.
that they just toss $50 in
Yep.
here and there, and then they have a chunk
Right.
of money that they can use for
That's a
massage and
great
blah, blah, blah.
idea.
So then they have the insurance for like the larger car accidents, the MRI that's 10 grand or 7 grand, and the larger things, but then they have like a side thing where they can go to their out of network provider and be able to see whoever they want to see.
For wellness.
Right. Get that massage once a month. You
Right.
know, use that for your wellness care.
Right.
Yeah, one of our members of Undercover Vitality we were talking about this, and she's like, well, I'm not sure where I'm going to get the money. You know, I wish I had more money to spend on just true healthcare. And I told her, well, what we do in business, like how I started the community Undercover Vitality, because we had to build a platform, we had to hire somebody to be our integrator and all of that, is we took 1% of our income and we just put it in a different bank account.
Right.
So I said, why don't you do that for like your wellness care? Take 1% of your paycheck. That's not a lot, but you put that in your side bank account every payroll, and it starts to add up.
Yes.
And then you can use 100% of that for whatever you think is good for
Yes.
you.
Yeah.
Totally agree.
No, I definitely agree. It's like a retirement fund. You pull out a little chunk of your income
Yes.
and you put it away.
You don't even
and
see
you
it.
don't you don't
Nope.
even see it. You don't touch it until you need it, and you go to a provider that you truly want to go, and not some revolving door in and out real quick. No one's listening to you type thing.
No, and that's true. Like I see this with some of my patients that are on the medical merry-go-round. Oh, my family doctor saw something on my x-ray and wants me to go see a rheumatologist. And I'm thinking to myself, that's a flippin' waste of time. You don't have any kind of rheumatology problem. But they go and they say, no, I'm fine, but they want me to see this neurologist now. And it's just, these guys are buddies. These medical guys are buddies.
Totally.
They're in the same insurance or they're same hospital network,
Yes.
and they have quotas to meet.
Yes.
So they call each other like, dude, I'm short this month. Send me people.
I 100% believe that. Oh, yeah.
I have something real sketchy that I heard a long time ago. I was a student. So some of the bigger box PT clinics, I'm not going to say any names, they will hire consultants, physicians that will be on staff as consulting them for I don't even know what. Well, those doctors get a little kickback every time they send a patient to a X, Y, and Z clinic. So it's like they're not consulting anything. They're literally just, okay, we can talk to this doctor if need be. The physical therapists are not talking to that doctor, let me tell you. But Dr. Smith is getting
Right.
25,
He's getting a kickback from referring.
250, even if it's a little bit. It's like,
Yep.
well, they can legally do that because they're on staff as a consultant.
There you go.
It's like,
There you
oh
go.
man, it's a
Yep.
game.
It is the game.
Yep.
And
Yep.
referring to themselves, and because they get more money if they do this type of testing, they get more profit if they do this, they get more profit if they do that. So you're running
Mm-hmm.
a bunch of unnecessary tests just to make a buck.
Mm-hmm. Mm-hmm. Yep. Yep. Exactly.
If you
Exactly.
just sent them to the right person,
Mm-hmm.
then that
Right.
person can help that person quicker
Right.
without going through a billion hoops.
Right. And there's also in the conventional medical realm, once they have that diagnosis, then they have their, I call it an algorithm. It's like, okay, you have this diagnosis, okay, you send them for this test. Either it's positive or negative, and if either way, okay, there's another test, and then positive or negative, and then there's always a next
Something.
step, but it still all revolves around the conventional medical model.
Right.
And how disempowering to the person when you keep getting these labels. That's what I have a problem with too. It's like, you have degenerative disc disease and you have arthritis and you have this and this, and it's like you see this list on your my chart and you're like, oh my god, like I'm dying pretty much, and it freaks you out, and
Exactly.
you give away your power when you start to freak out about things like that.
Take back your power.
Yes, exactly.
And I
Yeah.
talk about that, like
Yeah.
what a diagnosis is. A diagnosis is literally a Latin translation of your signs or symptoms.
Yes.
That is it. It
Yes.
is all it is, and it
Yeah.
just puts you into the system.
Yeah.
Yeah, yeah, that's near and dear to my heart, and it like breaks my heart when somebody comes in and is like, or I talk to them, they're not a patient. I talk to them and I say, I could probably help you with that. No, no, I have this. Nobody can help me. Like they are have internalized that defeat.
Yep.
Yep.
And they've taken that label on. It's like,
Yep.
no, my discs are degenerated and I cannot get better. And it's like, you can.
You can. I know. I know.
You
I
can.
But
know.
it's cool when you can show them that, which is awesome.
And
which
it's
is
Yes.
yeah,
a
and
huge
you
part.
have the time to do it.
Mhm.
Instead of being so quick with multiple patients at once and things like that.
Right.
It's like how, people deserve better than that. They deserve one-on-one care, not in and out in 2 minutes. They deserve that quality time, and an insurance model just does not allow that.
No.
Mm-mm.
How
It
many
doesn't.
times too have you come across someone that, let's just use the disc example, and you kind of explain it a little bit differently and the person's like, nobody ever told me that. Like nobody
Right.
ever explained that to me.
Right.
And it's like, well, they slapped the label on you, no problem, but they never like elaborated about like what you can do, how you can feel better. Like, no, they just kind of, and didn't even
Right.
explain the anatomy, nothing.
Right. Oh, it happens a lot. Like, oh, these are your X-rays, or this is your MRI. If they bring in their MRI, and here's your problem right here. Really? That's it? Like, it's not like this just this esoteric, like,
Right.
I'm a loser label. It's something. No, it's right there. It's a physical thing, and we can work with that.
Right.
Mhm.
Right.
Like with you guys. Like with you guys, you can show them. I'm sure you guys have like some pelvic 3D model at your.
Yeah.
Oh yeah.
Yeah. Oh yeah.
All the time.
Mm-hmm.
Right
There it
next
is.
to us all the time.
Right.
And we have
Right.
the time and the knowledge to explain all of that, and we're not burnt out and we're not exhausted, and
Yes.
just another thing, it's like, put on your clinical hat, put on your insurance hat, put on the clinical hat, put on the insurance documentation, peer-to-peer review, this note, that note. So it's so jumbled in your brain too when you're trying to treat someone, and then you're trying to remember, oh wait, what phrase do I need for the insurance?
Oh gosh.
It's just kind of too much back and forth, and it's disrupting the plan of care.
Mm-hmm.
It really is. It
And
really
people
is. So
know that.
what, like, I know I've gotten to know you two in our two conversations, and I kind of have an idea to answer this, but what sets you two apart from two other physical therapists who would never make the jump outside of the insurance model?
I'm tired in the insurance model. I don't have it's almost like the lack of motivation. I'm trying to just survive my day.
Yeah.
Because you're forced to see 12 people in a day, 9 people in a day, on top of all the insurance and the documentation. It's the lack of motivation to grow within your specialty. For me, like, it was hard to learn new things when I'm so tired at the end of the day.
Yeah, and I think that there are really good therapists in the system. There really truly are, even in the pelvic realm. But I think that what differentiates us is that we're stubborn. So we're like, we want to get down to the bottom of it.
And we have time
to do it.
We
Also want to be the best of the best because we love it. So it's like now we have the time and we can be on the top of our game. We can know the current research. I don't want to be 10 years behind here on
Yes.
a hamster wheel.
I don't want to treat 12 people a day. I want to do 7.
Right.
That's the biggest. 7, 8, 9, 10, 11, 12. 5 more people in my day. It's like, I can't.
It's exhausting.
So now that we're taking it back a notch, increasing our time to see the people, I have the energy to do Pelvicon.
Mhm.
We have the energy. I mean, we're going to a huge pelvic conference. We would never be able to do that in a hospital setting. Just because we're just so tired. We've been treating all day. We're dealing with the insurance crap. It's just like you want to go home and just do nothing. Now on my weekends, it's like, I want to do my Sarah Duvall.
Right.
I have more of a desire because I'm not so exhausted during my work week.
Mm-hmm.
Yes. And I think that is what makes a difference, that you love what you do so much. You want to get better and better and
Yes.
better at it. But when you're inside that system and you're overworked and you're stressed and somebody's telling you you didn't get paid for these 5 patients, you got to rewrite your notes and you got to,
Burnout.
And we always had the desire and the passion
Yes.
in us. And
Yes.
I feel like even at the hospital, we were treating at a really good caliber.
Mhm.
But now we've put ourselves in a situation where we can like really shoot for the moon here. And that's exciting.
Oh, yeah.
Mhm.
Yes, very
Mhm.
exciting. Yeah.
I am super thrilled that you've embarked on this journey, and I know you're like just beginning and you're already super successful.
Oh,
And
thank you.
oh, totally. And I can imagine that your patients just love you, what you're able to do for them. And for our listeners, if you've not gone to the pelvicaffinity.com website, please do, because it's so crazy that you make this fun.
We love our people.
Yes, we do. There's not a day where we don't laugh with our
Oh
patients.
my goodness. Oh my, all the time.
All the time.
I had somebody the other day that was like, she talked to her friend and she's like, isn't pelvic floor physical therapy so awkward? I did it before. And she's like, what do you mean? Like, we're laughing. We're talking about the weekend. We're talking about haircut. We're talking about
what are you making
And
for
I'm
dinner?
like, no.
I'm hungry. It's like, it's like we'll be deep in there. I'm like, so what's for dinner? You doing a crock pot recipe? It's like I'm talking about their beef stew,
like, ooh,
while I'm in their vag.
tell me about your family drama that we were talking about last week.
Ooh, I love your family drama. What's the latest with the stepbrother and the stepdad? That's what I want to know. So it's, we're very close with our people, as well as providing like exceptional care, and then knowing exactly what we're doing and the why behind it. So you can have fun. In a hospital setting, it's like, no. Now we can have our personalities shine through and be comfortable.
Yes. Oh, like I said, I'm super thrilled for you. So,
Thank you.
I know last time I gave you the surprise ending question, but today, and this is going back to something we talked about last time too, just your number one don't for pelvic health. Let's end with your number one don't lifestyle habit. Mm-hmm.
You'll go first this time.
I think posture. I think the sitting thing needs to change. Like people that are sitting on their tailbone all day, that's a doozy. And we see that all the time. It really ramped up when people started working from home. So we get a lot of like tailbone pain, pelvic pain, and I think it's really from poor sitting posture. So that's probably my number one to
I like that one.
do.
Chugging fluid. Chugging water. When you chug water, it overflows your kidneys and it fills your bladder way quicker. So a lot of people will have urgency incontinence and frequency a lot. But if you sip your water throughout the day, you can fill your bladder at the normal rate where it will allow you to go every 2 to 3 hours. Versus if you chug, you're going to probably pee it out 20 minutes later. Therefore, your body didn't have enough time to absorb the water. Therefore, you're actually more dehydrated.
Oh my gosh. 2 pieces of brilliance.
And those are things that could literally fix people.
Fix like people.
Okay, it's fixed.
Fixed.
Wow.
They think I have the magic hands. No, the magic brain. No, it's as simple. It's like people chug. Well, I didn't get my water in, and I'm chugging at 7 p.m. Ooh, girlfriend, boyfriend, whoever, you're gonna be up all night, and they are. Or oh yeah, I didn't drink my water, so I chugged down at like 1 o'clock, and I have my urgency incontinence at 3 o'clock, 4 o'clock, 5 o'clock, and I'm like, what's going on here? So it's a lot of like education and just simple bladder health.
Yep.
Love it.
Sip, don't chug.
Sip.
And don't sit on your tailbone.
And
Yep.
don't
sit on your butthole. Sit on your sit bones.
Oh, I gotta write that one down.
Yep.
All right, you too. It's been awesome.
Thank you so much, Dr. Nancy.
You're welcome.
Always have a blast with you.
Yes.
And for our audience, thank you so much for joining us. And as always, with each passing episode, I hope you get closer to being your own best expert. Bye for now.
Bye.